I'm Dr. Streicher. Your question is, I have fibroids. Is it okay to do nothing? I'm Dr. Streicher. Your question is, I have fibroids. Is it okay to do nothing or do I need to take action? I'm going to give you the inside information. Every day, hundreds of women are diagnosed with uterine fibroids. Fortunately, the overwhelming majority of women who have fibroids need do nothing about them. But how do you know? How do you know when it's safe to ignore those fibroids and when it's time to take action? Well, I'm going to give you the lowdown on which symptoms should not be ignored. So let's start with bleeding. I mean, heavy bleeding caused by fibroids is much more about the location of the fibroid than the size of the fibroid. A plum-sized fibroid that lives on the outside of the uterine wall is generally not going to cause heavy bleeding. But that same size fibroid, if it's pushing into the uterine cavity, it can create a period that rivals Niagara Falls. And if your period is so heavy, if the bleeding is so heavy that you're changing your tampon more than you're changing your mind, well, you probably need to do something. And if you're routinely consulting your calendar to make sure social plans don't coincide with your period, you probably need to do something. But if you are anemic, if your blood count is really low as a result of bleeding from fibroids, then it's not a choice anymore. Then you really do need to take action. So let's move on to bulk symptoms. Fibroids are all sizes. Sometimes they're microscopic, but they can also grow to the size of a cantaloupe or a beach ball. And if your fibroids are so large that you feel the need to pee, even when your bladder is empty, and you can feel your own fibroids just by resting your hand on your belly, and people think that you're pregnant and ask you when the baby's due, and you're definitely not pregnant, well, you probably would benefit by taking action. But if you have fibroids that are blocking things, that are causing urinary obstruction, or are growing very rapidly, particularly if you're post-menopause, then it's not a choice anymore. Then you really need to take action. So let's talk about pain, because while we think about fibroids, we don't often think about pain, but some women with fibroids have a lot of pain. And what causes the pain is tissue necrosis. The pain actually dies if a portion of the fibroid outgrows its blood supply. Severe cramps can also occur if someone has really heavy bleeding, and as they pass those clots, the uterus cramps down. So if your fibroids are causing pain that gets in the way of your daily life, then obviously you would probably benefit by taking some action. But if your fibroids cause so much pain that you can't function unless you take a narcotic, well, you're in that category that it's time to do something. So pregnancy has its own set of issues. Now, most fibroids, and I want to be really clear, most fibroids do not get in the way of having a healthy pregnancy. But having said that, miscarriage, preterm delivery, and the placenta separating too early are increased by the presence of large fibroids. Postpartum hemorrhage, heavy bleeding after you deliver the baby, is also more common in women with fibroids since the uterine muscle is unable to contract normally after the baby comes out. So if your fibroids have caused a serious obstetric complication, your obstetrician is going to advise you if you might benefit from action or if you absolutely must take action before a next pregnancy. But how about even just trying to get pregnant? When is infertility going to be an issue with fibroids? Well, infertility in women with fibroids is very challenging because there's so many other factors that can cause problems getting pregnant, such as age-related ovulatory dysfunction or a sperm count. But having said that, fibroids can sometimes block the fallopian tubes or prevent implantation of pregnancy. The impact of fibroids on fertility has increased since it is increasingly common for women to delay pregnancy, which gives fibroids extra time to grow. So in this situation, a fertility specialist is the best person to advise you if you would benefit from having those fibroids removed and taking action, or if you absolutely must take some action in order to conceive. So after all this, what if it's clear to you that it's time to do something, that either you would benefit from it or you must take action? Well, your personal plan depends on your symptoms, your age, your pregnancy plans, the location of the fibroids, and of course, availability of alternatives. For some women, hysterectomy is the best option. but it's rarely the only option. One would think that hormonal contraception would act like fertilizer to fibroids, but it's actually quite the opposite. Hormonal contraception, like birth control pills, does not accelerate growth and sometimes will even decrease the bleeding. There are other medications that can be used to decrease bleeding. And then myomectomy, which is the removal of the fibroid with the preservation of the uterus, also is an option, particularly for women who want to have a pregnancy. Fibroid embolization, endometrial ablation are all viable options depending on your personal situation. So for lots more information, videos, updates, and articles, check out my other videos and go to drstreicher.com. And if you want to do the deep dive about fibroids and alternative treatments, check out my book, The Essential Guide to Hysterectomy.